Good morning, Ms. Jones. My name is Elizabeth, and I'm going to talk to you about your new medication, which is known as Sertraline. Sertraline is a generic name for Zoloft, and therefore Zoloft is the brand name. Sertraline is a common medication used to help with depression, anxiety, panic attacks, and OCD. When the doctor prescribes Sertraline for you, Sertraline is expected to help your brain use a chemical called serotonin. Serotonin affects your mood, sleep, and how you handle stress. When serotonin is low, people may feel sad, worried, or overwhelmed. Sertraline helps by keeping more serotonin available, which can lift your mood and help you feel calmer over time. It doesn't change who you are, it just makes you feel lighter and able to manage your stress and your issues. Once you take the medication, your body absorbs sertraline slowly. You might notice small changes in 1 to 2 weeks, but full effects usually take 4 to 6 weeks to be visible. After you swallow sertraline, it goes to your liver. The liver acts as a filter and changes the medicine into smaller parts that your body can handle. Your liver changes sertraline into something called a metabolite. Once it is absorbed, it travels through your bloodstream and reaches your brain. Your body gets rid of it through your stool and urine. The medication stays in your system for about a day, and therefore the medication is ordered as once daily dose. Sertraline is designed to support long-term mental health. Most people stay on it for 6 to 12 months after they start feeling better. This helps prevent symptoms from coming back. Some people stay on it for a long time. It is important to have continuous monitoring and continuous check-ins with your provider so that the provider is able to monitor how well you're doing while on this medication. I can see that the doctor has started you on 25 milligrams dose, which is used as a gentle starting dose for 2 weeks, once a day, and then the dose will be increased to 50 milligrams daily. You will then come in to see the doctor after 1 month, and the doctor can decide if the dose needs to be readjusted. There are some possible side effects that will go away as your body adjusts to this medication. You might notice upset stomach, trouble sleeping, headaches, dry mouth, or loose stools. These symptoms usually fade after some time. However, I would like you to be able to monitor some severe symptoms, and if you do notice any of these symptoms, kindly call the clinic immediately so that we can be able to tell what is going on with you. For example, if you do notice severe rash, fast heartbeat, trouble breathing, severe muscle stiffness or shaking, kindly note any of these symptoms and call us immediately. We also have some special considerations for children and teens. Sertraline helps children with OCD. They may have a slightly higher chance of mood changes when starting, so close check-ins are important with the parent and provider. We do not want children to start feeling suicidal and not contact the provider or let anyone in the family know. This is critical. For older adults, we also know that they are sensitive to side effects such as dizziness or low sodium levels, and therefore they should start on a low dose and then progress to higher doses. These are things that we really have to pay attention to when we give medication to older adults and to young children. As you start taking sertraline, kindly note that it is important to take the dose at the same time every day. You can take this medication with or without food. And finally, do not stop taking the medication suddenly. Always check in with the provider before you stop taking your medications. And if you feel that there is something that is so critical that is making you want to stop the medication, kindly call the provider so that we can work on it. For now, I wish you the best as you start your new treatment, hoping that you are going to keep on track with this new medication. Call us in case of anything. We will always be here to listen to you and to help you along your journey of treatment towards mental health. Thank you.